Hello, hello. Uta Hagen here of Trans Widow, Uta Hagen YouTube channel and Substack blog, utahagen.substack.com. Please do go to the blog for the, in chronological order, transcription of Dr. Patrick Laffert's testimony at the Federal Trade Commission, this day-long event, including detransitioners, whistleblowers, attorneys, and various concerned individuals, happened on July 9th, and the website, the government website, you can view the whole 6 hours on, is FTC.gov /media/danger-affirming-care-minors. I will put that in the notes. It's lengthy. It goes by very fast, and that's why I want to present to you some of the points made by reconstructive plastic surgeon and Navy veteran Dr. Patrick Laffert. So he didn't say this exactly, but my assumption is that Dr. Laffert has done reconstructive surgery on our military service members who have been injured in battle or in accidents or something like that. And therefore, his take on why these gender-affirming so-called surgeries are cosmetic surgeries. They are elective, and they do not fall under the category of reconstructive plastic surgery. And we now are finding out that these surgeries have been billed to insurance companies, to Medicaid, or to families who are paying out of their own pockets. They have been billed as reconstructive surgeries, and this is based on no medical consensus, no evidence, and thank goodness for some of these doctors who are trying to restore our faith in the medical profession. I just want to mention that my 2 or 3 year old now orchid is blooming. I'm very pleased with it. It's going to share the screen, and I call this bouquet from the garden a moonlight bouquet of mainly white flowers. Okay, I'm going to start. I decided I'm not going to read this in the order that he spoke it, because there are certain dramatic points. I am editing him a little bit. I'm taking the liberty of doing that. So he says, I'm sure you all remember Avery Jackson, the, in quotes, trans girl who at 9 was on the cover of National Geographic. Avery was given the gold standard in gender-affirming care. He was chemically castrated and sterilized with blockers, that is gonadotrophin agonists, which affect the pituitary, to hold off male puberty. Nevertheless, he does not pass and never will. Now at age 17, Avery has come out as non-binary, but that's not the worst part. He also identifies as asexual, meaning he doesn't experience sexual attraction. This is undoubtedly the result of the medication used to delay male puberty. The president of WPATH, Dr. Marcy Mark Bowers, has said on camera that so-called puberty blockers, which are used to chemically castrate sex offenders, chemically castrate the young boys who take them as well, leaving them incapable of arousal or orgasm. So there is this thread of sensitivity and the loss of sexual arousal and erotic sensibility in the in the resulting time after these surgeries, which cause nerve damage and scar tissue interfering with these sensations. He is completely sterile, this kid, Avery. He can, okay, so he was 9. I don't remember. I'm not sure how old he is. I think he's 20 now, something like that. So Bowers has said that this treatment leaves them incapable of arousal or orgasm. For adult sex offenders, the process is reversible because that's an adult. For boys like Avery, the experiences that accompany it are that he is sterile and he does not have sexual arousal that is normal for a male or normal for a female. All of these things were stolen from him, and he has said that transitioning, in his words, ruined my life. It's high time that we stop pretending that children can make an informed decision to transition or take these blockers. Parents like Avery's who try to monetize their child's struggles with gender identity, oh gosh, okay, are mistaken, and I hope that they live to speak publicly and say that they regret it. Okay, now, Dr. Laffert speaks of so-called euphemistically named top surgery, and the result of that is neither the capacity for breastfeeding or erotic sensibility can be restored for these girls. In the case of genital surgery, there is a loss of reproductive capacity, as well as degradation, if not complete loss, of erotic sensibility. In addition to these losses, there's the additional risk of urinary blockage, urinary leakage, incontinence, the risk of fistula formation, which means little holes, resulting in fecal leakage, that means poop, through the counterfeit vagina, chronic wounds, the need for repeated surgeries to correct these conditions, and the markedly elevated lifetime risk of cancer caused by such chronic conditions in patients receiving high-dose sex hormones. It does make me wonder if the 2 out of 70 ex-husbands of the 70 trans widows I have data on, 2 of them detransitioned. I wonder if they detransitioned because they developed some of these terrible results. Dr. Laffert continues, when surgical procedures such as gender affirmation surgery are only based on low to very low quality evidence, then by definition those surgeries must be labeled as experimental surgery. The failure to label it as such is itself an act of deceptive labeling. This was from the latter part of his testimony, and I felt that it's very important to bring this towards the beginning of anything presented about it, because as you are listening to this, it's hard to absorb. Okay, so there's this business about the Delphi process. The decisions to recommend these horrible things that I just described was not made through studies where statistically significant numbers of subjects were examined for sexual function afterward, for various quantitative life quality of life aspects. There are no studies that present that. It's all surveys about how these people feel about their quality of life. And Dr. Stephen B. Levine, a no longer affirming psychiatrist, has said that you have to interview these post-op patients at length because they say they don't regret it. Is this sunk cost fallacy? They've put too much into it. They can't say it was a mistake. Or is it that they didn't commit suicide and so they say, yes, I'm satisfied with this? Because what they found is that the quantitative pieces of it, keeping their jobs, whether or not they have to have repeated visits to the emergency services at hospitals because of what I just talked about. Those are quality of life, quantitatively documentable events that the individual who has sunk so much of their money and identity and time into changing their sex, they might not admit that they actually have a lot of problems in their life. So the Delphi process is the consensus of doctors that the WPATH people, including Dr. Marcy Mark Bowers, and which was contributed to the recommendations of the standards of care number 8 that was published a year ago, a little over a year ago. They also allowed Dr. Rachel Richard Levine of the Biden administration through his office to send emails to these World Professional Association for Transgender Health doctors and members, some of whom are not even doctors, who are just transsexuals. He recommended that they don't have the age guidelines. And he made a few other recommendations that came out in discovery for a lawsuit where the ACLU and GLAAD and HRC, I get mixed up between HRT and HRC, the Human Rights Commission, HRC, took Alabama to court for its law which banned these really brutal treatments on children who cannot make an informed consent kind of decision about this. Okay. Dr. Laffert maintains that there is no body of evidence that demonstrates the accuracy of the diagnosis. It's very clear. We have all these detransitioners. There's no long-term treatment efficacy to support the labeling of standards of care. And he maintains that he says, the word standard of care is intentional mislabeling. That phrase suggests to us that there is a level of scientific evidence above level 3 in plastic surgery. That's a high level that you're going to go in and do this intrusive surgery because it is restoring the patient's form and function. And level 3 is sufficient to guide medical decision making. And therefore that level 3 in plastic surgery would be called standards of care. Even though this is plastic surgery, the WPATH people feel that they are on a different trajectory. They are their own little world over there. No one is going to supervise what they are doing, and so they don't have to apply standards that have already been established in the field of medicine. He said these, what they call gender-affirming surgeries, they label that as reconstructive surgery. This is patently false. Speaking as a plastic surgeon, that is no small distinction. I'm getting overexcited. These poor kids. Reconstructive surgery is surgery that aims at the restoration of form and function that has been lost due to trauma, surgery for cancer, infection, or congenital or in utero deformative events. The wound or the lost part can be objectively defined, and those findings guide the surgical planning. The restoration of form and function is key. Gender surgery is not based on any loss of form or function. It's based on the emotional life of the patient. The motivation for surgery is emotional and subjective. And the success or failure is measured using subjective testings, ones like quality of life surveys. This is the definition of cosmetic surgery, meaning elective cosmetic surgery. Okay. And also, and then I'll end with this, to offer such a surgery without offering other therapeutic options to parents and patients is an act of deception by concealment of facts that parents and patients have a right to know if they're going to give consent for surgery. The WPATH document, in its chapter on surgery, further deceives by suggesting that affirmation surgery is effective because such surgeries, in quotes, this is from WPATH, begin with proper patient selection, meaning, oh, we're like God, we can pick and choose which of you is going to do well, even though they don't know what kind of emergencies will happen post-surgery. They have their God-like capacity for proper patient selection. And then Dr. Lafferty says that's the first chapter, the first paragraph of the chapter on surgery. Now, this seems to me that actually puts them at risk for the medical malpractice cases. Another Dr. Lafferty quote, the transgender treatment industry, I like that, transgender treatment industry has no process or test instrument that can be employed to confirm the diagnosis of gender discordance. There is no process by which the patients are selected for surgery versus not surgery. There's no testing process that stratifies either risk or benefit. There isn't even a common language of description, whether the condition or its treatment. There is a Dr. Tolstrup. This is me now because I'm going to summarize this. Dr. Tolstrup did a scoping review. That's a review of as many studies, published studies as possible. This was a scoping review of 849 research papers, 849 research papers published on so-called top surgery, which is the amputation of healthy breasts of females. And there is no strong evidence presented in 849 published studies that these female patients have a better life after they have had their breasts amputated. The quality suggesting or supporting that is a good plan of action. If a girl says she doesn't like her breasts, the quality of all of those 849 studies, the parts of those studies supporting these decisions is low to very low, meaning either the studies are very small or there is obviously researcher bias. This is my second take on this. It's a lot, and mainstream media is not covering this. And if you ask me, the Federal Trade Commission should actually be putting this out through more channels and in shorter segments. But I'm doing my best. Please like, share, and subscribe. Take care of yourself, plant the flowers, and then count the butterflies.